Good afternoon and welcome to the COVID-19 media briefing on February 23rd. Today you'll hear from Mayor John Tory and Dr. De Villa. First up, you have Mayor Tory. Go ahead.
Well, good afternoon. Today is Pink Shirt Day and hence my pink tie, and it's a day that was originally begun in Nova Scotia where students wore pink shirts in solidarity with one of their own who was bullied when he wore a pink shirt. It's a day each year that is meant to raise awareness of the terrible toll that bullying can take and to encourage people to keep their eyes and their ears open and to speak up and to speak out against bullying. Days like this are especially important. They're important each and every year, but they're especially important, I think, in the wake of the pandemic. The experiences of this long period of instability, in many cases of confinement and dislocation, have left many people themselves off balance and, in some respects, maybe not okay. We have to be sensitive to that and focus on ourselves as a city, on healing ourselves, on getting past the divisions which have arisen. I focus instead of the division on the incredible unity that has been displayed by the fact that 91%, approaching 91% of us have come all or part of the way through the vaccination process in the 12-plus age groups. And this is an incredible accomplishment. It is something to be very proud of, but it is also something that demonstrates that we have a unity of purpose in this city as we've gone through the pandemic that is probably unsurpassed anywhere in the world. And so it is a time to come together, and it's a time to recover together, because there's a lot of recovery to be done, both on the personal side for people who have been affected adversely by the pandemic, but also for businesses and really just for us as a community to get past some of the polarization, get past the talking at each other and begin to talk with each other again. And it's a time to support each other more than ever. You know, there were various times, especially at the beginning of the pandemic when the unknown was overwhelming us, that we had to support each other, and all the way through with many of the different programs and initiatives. But there's now a continuing need, as great as ever, to support each other, to support the local businesses and people, and to push back against those who would divide us for whatever reason. And that includes not just now, but always pushing back against those who would commit acts of hatred and discrimination in our city. The recent episodes of anti-Semitism in our school system cannot be allowed to stand. And by that I mean that not just speaking up against them is necessary, as I discussed with the school board chair yesterday, and speaking up as the school board officials themselves have done against these acts of anti-Semitism, but also acting to address the root causes of these particular kinds of actions. Anti-Semitism and other forms of hatred and discrimination are a cancer. Left unaddressed, cancer spreads. And in my conversation with the school board chair, Alexander Brown, I emphasized our willingness as a city to work with the TDSB to educate and to push back against the prevalence of anti-Semitism that we're seeing in recent weeks. I believe that education itself is the key to this. And as we emerge from the pandemic, we simply cannot let discriminatory conduct or polarized behavior dominate the way that we try to rebuild and to recover. We won't rebuild and we won't recover as well if we allow polarization to set in, and certainly not if we allow any forms of discrimination or hatred to prevail. If ever there was anything we should be in together, all in together, to use that expression that was so much used at the beginning of the pandemic, it is in the task of recovering from this awful nightmare, supporting each other, and recognizing the various traumas that people and businesses have been through. And I will be trying to take an active role in fostering that kind of an environment, because that is who we are here in the City of Toronto. We are getting through the pandemic thanks to the COVID-19 vaccines and our ongoing Team Toronto effort to help residents get vaccinated. This week, we're on track to reach over 1.5 million third doses delivered so far to residents across the City of Toronto. And that is excellent progress, and it shows how our Omicron action plan, introduced just before Christmas, worked to make sure that residents could get their third doses and that we could get through, collectively, the Omicron surge. Whether it's first or second or third doses, we have been determined throughout the pandemic to deliver vaccines to everyone, everywhere in our city. No one should be left behind. As we have in previous vaccination drives, we're at the point where we can again roll out even more hyper-local, equity-focused vaccine clinics. The work is underway now, as Dr. De Villa will outline today. Team Toronto had 150 mobile clinics operating across the city over the last week, including 51 of them in schools. I visited one of the school clinics in Scarborough and was pleased to meet a fairly steady stream of adults and kids, mostly from the local neighborhood, coming to get vaccinated. We anticipate that pace, 150 mobile clinics a week, will continue over the next month. And again, Toronto Public Health will be following the data to make sure that mobile clinics are focused on helping drive up vaccination rates in neighborhoods where they are lower. And we will be deploying all of our vaccine engagement teams and other outreach efforts, including VaxTO, to help people find out where they need to go to get vaccinated in their communities and why. Even as we've made so much progress, there's still much more to be done. I noted with interest when I was at the school clinic on the weekend that almost all the people I spoke with were people who had received an email and in some cases a phone call encouraging them to come out a very short distance from their home to that clinic. So it proves that that system is working. Starting back this weekend, our Shop and Vax clinics will be out helping residents to get vaccinated in shopping malls, in community centres, and other locations around the city. In total, 19 mobile clinics will be operating this weekend, including 5 clinics on Saturday at the Lawrence Allen Centre, the Stockyards Village, the York Gate Mall, the Young Shepherd Centre, and the North York Sheridan Mall, and this latter location will also be open on Friday. We want vaccine clinics that are open and accessible to residents, so it makes sense as we move into a much more local strategy again that people will be able to get vaccinated where they shop, where they study, where they worship, where they play, and nearby to where they live. As an example, the neighborhood Toronto Public Health is focused on, the neighborhoods they're focused on, have an average vaccination rate for 2 doses of 83% compared to 88% across the rest of the citywide number, so that they're running a bit behind still. And for 3 doses, those very same neighborhoods have a vaccination of 45%, so that our work is not done as yet. Far from done. We've got more to do, although we've come so far. I continue to urge any resident who is yet to get vaccinated to please get vaccinated. And if you don't have your 3rd dose yet, if you are eligible to get it, please don't wait. The 3rd dose will make sure you have the best protection possible against COVID-19 and the Omicron variant. It's worth taking the time to get this 3rd dose, and we're continuing to make it as easy as possible for people to get their 3rd dose. Again, I want to say thank you to Toronto Public Health under the leadership of Dr. Davila and her entire team, and all of our Team Toronto partners who have done all the work they're doing literally in hundreds of mobile clinics over the past weeks and of course in the coming weeks. Each time I go out, I take the time. One of the main reasons I go is to thank the staff, and they're people who are working on weekends and on holidays and at night to make sure their fellow residents can get vaccinated. And this will help us to keep our progress up and to keep making the difference that these vaccination rates have made, which are at a level basically, I think, unsurpassed for other cities of our size and type in all the world. I do want to recognize the amazing Team Toronto effort that got behind the Vax the East campaign and share with you some results of that success. It was a 10-day hyper-local campaign which delivered more than 3,100 vaccines across Toronto's East End. It was an all-hands-on-deck effort with the weekend clinics held at the Ontario Science Centre and the Thorncliffe Park Community Hub a week or so ago, followed by 34 pop-up clinics over 8 days in Scarborough schools. In total, Team Toronto vaccinated 3,127 people, including 1,240 children aged 5 to 11 during the Vax the East initiative. Some of the other busiest pop-up clinics were over the Family Day long weekend in Dorset Park at the Glamorgan Junior Public School, the one I attended, where 88 people, including 58 children, were vaccinated on Sunday, and in Eglinton East neighbourhood at the John McCrae Public School on Family Day Monday, where 103 people were vaccinated, including 57 children. I know these numbers don't sound as big as some of the numbers we've shared with you before, but as we grind it out, as we go hyper-local, as we go door to door, we are picking up people who have been hesitant for one reason or another, and these are impressive numbers to put on the books, and they gradually and slowly but surely move us to the place where we need to be. As I mentioned, I did visit the Glamorgan Junior Public School, and I can just tell you that the success of the resident-by-resident outreach campaign with emails and phone calls and knocks on the door was evident, as was the dedication of the staff there, many of them from the Scarborough Health Network, but also from other community health partners. Finally, I wanted to deal with something utterly removed from COVID, but something that comes up this year as regular as clockwork, and it is a function of our kind of freeze and thaw weather, which we've seen, of course, in abundance over the last period of time, with another freeze, unfortunately, to come even through the rest of this day. and that is the subject of potholes. I know they're out there. I get around the city a lot. We have to have the right kind of circumstances to really get at filling them, but I should tell you that city crews have filled almost 10,000 potholes in the city in the first 2 months of this year. And so far in February alone, 3,269 potholes have been filled. But because of the recent rain and snow melt and the warmer temperatures and the colder temperatures, this causes more of these potholes to occur when the pavement cracks and weakens, and it kind of caves in to create a pothole. Our staff in transportation services are well aware of this. They keep a very close eye on it. They can't begin the bigger blisses that happen on the weekends until the weather has stabilized to some extent, but I can assure you that a number of these pothole blitzes are in the planning stages, and as soon as the weather does stabilize, which is not too far from now into the month of March, we'll be out in much greater numbers repairing those potholes. If there are ones that are serious or not, quite frankly, anyone you deem worthy of reporting, you can report them at 311 via either just calling the 311 call center or via the new mobile app, which I was told yesterday now accounts for 17% of the service requests that are coming into 311. And so you can do that, including a picture, if you wish, of the pothole and its location. So you either can go to 311 on the telephone, to toronto.ca/311, or on the mobile app. So on that note, we will return to the regularly scheduled COVID briefing and ask Dr. Davila to present her report for today.
Thank you, Mayor Tory, and good afternoon. Looking at Toronto Public Health COVID-19 surveillance indicators, we continue to see positive signs that the Omicron wave is receding. The 7-day moving average for both hospitalizations and ICU admissions continue to decline. These, taken along with other indicators of decreasing COVID-19 activity, such as the amount of virus detected in wastewater and the declining number of outbreaks in various settings throughout the city, are positive signs and give us reason to be cautiously optimistic as we move closer to March the 1st and the next phase of the province's reopening plan. To best support this reopening and our ability to get back to many activities that contribute to our overall health and well-being, Toronto Public Health and our Team Toronto partners are increasing our local and community vaccination efforts by expanding mobile clinics and focused community outreach. While this includes vaccine events like Vax the East, which the Mayor just spoke of, we are also bringing vaccine clinics to schools, malls, and local social service providers, in addition to vaccine that is already available at pharmacies and through primary care providers. Toronto Public Health is also prioritizing locations where we can hold repeat clinics, as this builds confidence and trust with the community members and, based on our experiences from the earlier parts of our vaccination campaign, increases vaccine uptake. As these new opportunities to get vaccinated become available, I encourage all Toronto residents to get vaccinated if you haven't already done so, whether it's your first, your second, or your third dose. Evidence from jurisdictions all over the world shows that the less vaccinated you are, the greater the risk of experiencing severe outcomes from a COVID-19 infection. This is especially true the older you are, and we see that this is borne out in our most recent local data, which shows that if you are 60 years of age or older and have 2 doses of COVID-19 vaccine, compared to somebody who has 3 doses on board, you are at 4 times greater risk of being hospitalized, 21 times greater risk of being admitted to ICU, and 36 times greater risk of death. That's why we want to ensure that everyone in Toronto has the opportunity to receive the protective benefit of 3 doses of COVID-19 vaccine, and most especially those at greatest risk. The higher the 3rd dose vaccination rate across our entire population, the greater protection is provided to our entire city. For the last number of weeks, I've been telling Torontonians that we are looking forward to reopening, to a spring that we know will come, with cautious optimism. We're looking forward to engaging in activities we haven't been able to in quite some time. The proportion of Toronto residents who have rolled up their sleeves and taken up vaccine continues to amaze me. Our vaccination rates are the envy of other major cities the world over. And we continue to see a steady increase in first, second, and third doses across the city. The incredible efforts by Toronto residents to get vaccinated and to practice the measures of self-protection, including masking, physical distancing, and staying home when you're sick, is the reason we are able to participate in reopening. For our part, Toronto Public Health and our Team Toronto partners will continue to bring vaccines to where people live, work, study, and play. I'm asking Torontonians to continue to come forward for your COVID-19 vaccine, including your third dose, if you have yet to do so, and to continue to practice the measures of self-protection as the province moves forward with a gradual and phased reopening. By doing so, you'll protect yourself and you will protect the most vulnerable in our communities. You will keep us on the trajectory where one day we can put this pandemic behind us. With that, I'll now turn the microphone over to Lavin to moderate the questions.
Thank you, Dr. Davila and Mayor Tory. We'll now take questions from the media. First up, we have Sina from CBC News. We'll unmute you. Sina, go ahead.
Thank you. My first question is for Dr. Davila. Quebec is lifting the requirement for masks in schools for students on March 7th. Do you think, given the state of the COVID situation here, Toronto schools are ready for this step? Also, Quebec has decided to lift the mask mandate in schools for students first, and then will lift it for the other public settings. In your opinion, is this the correct order, or should the in-school mask mandates be the last to be lifted?
Thank you for the question, and it's a great one at that. So let's start off with what I've discussed in the remarks. And, as you can see, based on where we are in the pandemic and the trajectory that we've seen on COVID-19 activity, we are indeed entering a new phase of the pandemic. So the good news is that we have the tools and the knowledge to help protect us against the worst impacts of the COVID-19 virus. And so at this point in time, hearing about different provinces and different jurisdictions doing slightly different things, I think I can say this. We know that there will come a time when all the measures that have been put into place, including such things as masking, will be reviewed and ultimately will be rolled back. These things were put in place to actually protect us, and we know that we have the tools and the knowledge to do this. So for now, though, I would suggest that we take a gradual and phased approach to this, rolling back of measures, keeping in mind the actual situation on the ground, the epidemiology of COVID-19, and of course, using the tools and knowledge that we've acquired over the last 2 years in order to protect us.
My second question is for Mayor Tory. With the provincial government moving its budget deadline to the end of April, what will that mean for the city and your planning?
Well, we have a number of matters that we're hoping to get more support from the province on. They've been very good when it's come to helping us with a number of different things throughout the pandemic and before, including all the transit investment they're making and things like that. But we have some outstanding discussions we're having with them on supportive housing and items like that. And so I'm very hopeful that a number of these things, including more support for more affordable housing, will be included in their budget. And for us, we carry on, obviously the shorter term financial assistance we require, of which they've come to the table with a solid first step, is something we'll be continuing to work on, and that could fall within next year's budget, 2022, or last year's budget, and we're just going to keep working. We don't really care which budget year it comes from. We just need the help in order to make up for the transit ridership declines that we've seen and to avoid us having a substantial shortfall in our own finances.
Okay, thank you. Next up, we have David Ryder from the Star. Go ahead, David.
Hi, everybody. First question, I think, for Dr. DeVille. I'll follow on that masking question and try to pin you down a little more. Brampton's mayor is saying that Ontario should follow Quebec's lead and revoke the mask mandate for kids in schools. Toronto has a mask mandate generally for indoor public spaces that is going to set to expire, I believe, in April. Where is Toronto heading as far as mask mandates for kids in schools and indoor public spaces? Is that going away anytime soon, or does cautious approach mean kind of indefinitely?
So David, a couple of things. You're quite right. There are different mask mandates in different environments, and given the nature and the governance of those environments, some will obviously involve a discussion with the province, particularly in and around education, and some are more within the city's jurisdiction. But, as I've mentioned earlier, the point is that we are actually entering a different phase of the pandemic, and that means that we constantly have to watch the indicators. There will, of course, come a time when the various measures that have been put into place to protect our health from the impacts of COVID-19 will be reviewed and ultimately will be rolled back. These measures were always meant to be done on a temporary basis and as part and parcel of what was best used to protect our health and the health of the rest of our community. So these are constantly being assessed, but for now, it is a gradual and phased approach with respect to bringing them back. And we'll, be sure to advise you and members of the public as we, look over the data and make sure that we're following the science in drawing back these restrictions or particular protections in a manner that's consistent with what we're seeing on the ground with COVID epidemiology.
I'd just like to add a comment to that as well. I have found that Toronto has gone the right way, and certainly in terms of my own personal decision-making, that I've gone the right way in following the advice of our Medical Officer of Health, and for that matter, the Provincial Medical Officer of Health. In other words, following the science, as Dr. Davila just said. I'm not a scientist and I'm not a doctor. Dr. Davila will tell you I ask a lot of questions when she gives advice to us about the basis for that advice and the implications of that advice, but I think that we're best to continue with the approach that we've had, which is to rely on the science, to rely on those who are expert to help us to, yes, reopen and make changes that will be favorably received by all of us, but to do it in that way that is going to be best for our continued public health and to make sure that no matter what, we don't slide back into the state we were in just a few short months ago. So I'll continue to rely on her advice, and I think that served us very well up until now, and I'm sure will going forward.
Okay, so I'm going to take that as saying that Toronto right now is not advocating any change to masking in schools and or to public places, but you're going to continue watching the data. So tell me if that's wrong. But my follow-up question is about the BA2 Omicron subvariant that is starting to be seen. And I guess people are trying to figure out, is this something else we have to be worried about? I'm hoping, Dr. Vella, you can tell me if that's being detected in Toronto and if that's something you're concerned about at all.
So, David, first to the earlier part of your question, you're quite right. We're encouraging continuing with the current approach to masking, and of course, we'll continue to watch the situation on the ground and adjust our advice in accordance with the epidemiology. And then on the epidemiology of BA2, certainly it's something that has been seen the world over and that we are all watching very carefully. This particular sublineage, as it's called, of Omicron appears to have greater transmissibility. I think there's still a lot that has yet to be understood about this particular sublineage or subvariant. There are some thoughts around, might it be able to cause more significant illness relative to BA1, the original Omicron. But I think there are still a number of studies that really have to be conducted before we have a very fulsome understanding. Unfortunately, David, I don't have specific numbers for Toronto today. Perhaps we can follow up offline. But I would say this, whether it's BA2 or any other form of COVID, at this point in time, the entire community all around the world, public health officials the world over, are constantly monitoring and thankfully communicating very actively with each other in respect of new patterns of illness, which may suggest that there are new variants emerging. The most important thing that we can do locally at this time is to continue to make sure that we're using all the tools we have at our disposal in order to control the ongoing transmission of COVID-19. So first and foremost, this includes the distribution of vaccine and making sure that people who have yet to get access to the protective benefit of vaccine are afforded every opportunity to get that vaccine. As you've heard us say today, whether that's first, second, or third dose, we really do want to see people continuing to take the benefit of the protection of vaccine. It's one of the best tools we have in our toolkit right now. That, along with the use of self-protection measures, especially for those who are most vulnerable to the impacts of COVID-19, these are the kinds of things that we can do together individually and collectively to protect ourselves and reduce the likelihood of new variants and new challenges with respect to COVID-19.
Thank you. Next up, we have Momin Qureshi from City News Toronto. Go ahead, Momin.
Good morning. Good afternoon. Thank you for taking my question. This is for Mayor Tory. It's non-COVID related. Mayor Tory, this morning we heard from the Amalgamated Transit Union, both Local 113 as well as nationally, raising concerns about the number of transit workers that are being assaulted. They say there's been a sharp increase in that. And they made a number of suggestions this morning, including the potential creation of a task force between governments and the ATU to try to look at the problem and a public information campaign. And I just want to know if those are things or ideas that you would support or want to see.
I've had some very constructive discussions with the Local 113 executive, including the president, and I thank them for having that time to discuss with me some of the recent incidents, but also a pattern that I think a lot of people in Toronto wouldn't be aware of, how many of our transit operators and other employees of the TTC are subject to abuse or assault of one kind or another over the course of, say, a year or a week or hopefully not a day, but frequently. And so I have said that I will work with them and with Mr. Leary at the TTC to see if we can, adopt practices that might be in place elsewhere, some of which they brought to my attention from other cities, so as to provide more protection for these workers who serve us, and often serve us at odd hours of the day or in lonelier circumstances. And so I think they are in need of that kind of protection. And I would hope that Torontonians would focus on the fact that these are people who serve us and help us get around and who do a great job for us, and would, make sure they, would never think of being in any way abusive in their behavior, but also would, keep an eye out for things that seem to be heading in that direction on the system. But we'll be endeavoring to do some more things, including potentially a public information campaign in the wake of these discussions that we've been having.
Just as a follow-up, sir, you mentioned the public information campaign. I just wanted to know if there was any other specifics in terms of the kind of things you are looking at. Is it a potential task force or other things?
Well, we've just begun the discussions, and one of the things, for example, that presently is the case, I gather, in the law is that it is only people actually operating vehicles that are subject to some of the legal protections that exist, and in a way you have to ask yourself, well, why that would be. One of the cases we saw recently was a TTC operator in uniform that was just riding on the subway. And so these are the kinds of things we've begun discussions with the Local 113 and the management will carry those discussions, but I've certainly said the city will do whatever it can to back up any improvements we can make, any initiatives we can undertake to keep our transit workers safe, because they serve us and they do a great job for us, and they should be able to come to work like other people in a safe environment where they're well protected by measures that we have in place.
Okay, that's it for today, everybody. Thank you and have a great rest of your day.